Thanks for joining us on today's Les Ancre Thread podcast. Today, we'll be chatting about mastering medical aesthetics with Nicole Schaefer, a seasoned professional with 30 years in the aesthetic industry. Nicole shares her journey into medical aesthetics, starting by opening her first med spa at the age of 25. Her experiences with cosmetic injectables and the evolution of the industry is bar none. Nicole offers valuable advice today for aspiring injectors, emphasizing the importance of clinical education and gradual skill acquisition. This episode is certainly packed with insights and practical tips. Let's join in now. Nicole, welcome.
Thanks for having me. Very excited.
Absolutely. Nicole, why don't you take a few minutes and tell us about yourself?
My name is Nicole Schaefer. I am a licensed registered nurse, and I am also a licensed medical esthetician as well. I've been in the aesthetic world for about 30 years. And I also have a 15-year background in cardiology as well. I was always doing aesthetics, even when I was doing nursing, and I actually started in the aesthetic world first.
How did you get started in the aesthetic world? Cardiology, aesthetics, how did that transpire?
And I have always aspired to be in medical. Medical beauty always was my niche. And as I started to come into the roadways of figuring out how I can do this, I went to school as a esthetician. But with that, I had a background also in being a makeup artist. So I did makeup for a long time and then grew on that. And this sounds very cliche, but as a child, people, they ask, what do you want to do when you grow up? And I was like, I want to be a doctor or I want to be a nurse. And I actually did pursue that out of high school, doing the whole nursing thing, the aesthetic thing. I just got into it, into the aesthetic world. I opened up my first med spa when I was 25. Wow. And it was crazy because I was doing advanced facials, skincare, makeup. And then I met this woman who was an NP who was doing Botox. And Botox back then in 2000 was the only aesthetic cosmetic injectable on the market and one Juvederm. We were doing that out of my spa and seeing patients, and it was fairly new. And from then is when everything blossomed. I said, you know what? This is where I'm going. And really was playing with cosmetic injectables back in the 2000, in like around 2000, 2001. Being in the industry and seeing how it has evolved from where I started is absolutely incredible.
So after 30 years of being in this industry, you've probably seen it all at this
Yeah,
point. What are some of the myths about the job or just the industry as a whole that you've experienced?
I can tell you this, it's not easy. It is not easy getting your foot in the door. It takes years of being so proficient and being a master injector. And you really need to know the medical aspect of aesthetics. I've seen things happen, things do happen. And just because you go to nursing school, a lot of people come out, and I'm seeing this now. Girls are just going to nursing school to jump into aesthetics. Mhm. And yes, I love aesthetics. It's my world now. That's all I do. I breathe it, sleep it, eat it every day. You really need to have that education, that nursing 101, the knowledge, the clinical training, the whole clinical aspect comes into it. Yeah. So a lot of the advice that I give a lot of people that are aspiring to get into the aesthetics field, you're going to hear a lot of no. You have to put the work in. I highly recommend having that clinical experience in a hospital and getting that base and
Mhm.
slowly getting into aesthetics. Because you just don't open your doors and people are going to flood to you. It doesn't work like that, sadly.
Unfortunately not.
Yeah.
So, having education and knowledge and skill as your base, how do you, again, after 30 years, stay updated and stay on top of the trends and the technology that's out there?
Education, a lot of reading, a lot of being involved in different networks of the aesthetic industry, talking to other seasoned injectors, doctors, and really just really staying on the forefront of technology and the way aesthetics is going into. And like I said prior, the world of aesthetics, it changes so much and it changes every day. So it's your responsibility as a injector and listening to your patients to really find the knowledge, find the products, find out what is going to be the next. So I'm constantly going to events, reading about things, when you get a lot of information that way. And then
Mhm.
you bring it in, you try it. I do little clinical studies on patients and myself before I introduce it into the practice and really go ahead and use it on patients.
It's working because you look great.
Oh, thanks. I just turned
It's great.
55. I was like, oh, yeah,
Would never have guessed. Would
thanks.
never have guessed. Wow.
Thanks.
Good for you.
It's
Do you
your
have folks?
product.
Yeah. Did you hear that, folks? She said it's our threads.
It is amazing.
It is. It really is. What do you see as the biggest challenge ahead for the industry in the next 5 to 10 years?
Really educating your patients. I am a huge clinical educator. Your patients, if you don't educate them, you're not going to get that trust, that relationship. Coming into this as an aesthetic trainer and clinical educator to really keep those folks out there knowing and educating them so they know what they're getting. I get a lot of patients that come in from other practices that want to change things up, want to try different things, different provider. And I ask them questions. What did you have done? What was put into your face? I have no idea. For me, going forward, all you injectors out there, make sure you're telling your patients exactly what you're doing, exactly what you're putting in. My patients always leave with verbal what to expect and also paper. I always write and give to them what to expect because 9 times out of 10, your patient's going to text you in a day or two and ask you the same question that you answered or may have in your literature that you handed out. So foregoing and foreseeing to avoid those type of problems in the future is key and big for me.
I like that a lot. Coming from the outside of the aesthetic industry and making my way in from the company side, I really just always assumed that the protocol was in place for every patient to receive that. And the longer I've been in the business, the more I realized it's not necessarily industry standard, which is very surprising to me. Very surprising. Um,
Yeah.
so it may have been surprising for you in the last couple of years, or even just recently that you've noticed in the aesthetic industry.
They'll do this, but very baby new injectors are doing some things that they are not quite ready to do. And it can be not such a good result or outcome. So I see a lot of that. And I do. I correct some work because of that, because they think they're getting a better deal and it's less expensive. And they're going to an injector that's not as experienced. I'm just saying this from experience too. I trained for years before touching somebody. it's great. Everybody wants to jump in and start injecting because it's like it's exciting. It's an amazing field to be in. But don't run before you can crawl. And it's okay to take your time as a new injector to
Mhm.
gain your skills and be super proficient in that element of injecting. So,
Very well said. And for folks that are listening or watching, Nicole and I did not pre-discuss this, so I'm thrilled to hear you say this
thank
because
you.
one of our stances at Les Craie has been from the very beginning, like you said, you crawl before you learn to walk or run, meaning we want you to be very proficient at putting in the mono and screw threads before you ever touch one of the big barb threads. The barb threads are sexy and they're fun and they look great on social media, but if you don't know what you're doing, that's bad news, sad for the industry as a whole. And that's what scares me and why we take our training so very serious. But outside of the education and the experience, what would you say is the most important lesson you've learned in your career in aesthetics?
Don't ever be too confident. Stay humble and always be a sponge in learning, and don't take criticism in a bad way in this industry because it's learning.
Mhm.
So you can't get
True.
offended. You need to have a thick skin.
And it sounds like you've got a very curious mind as well, or a mind for learning, which
Oh, I
would
do.
bring you to just an ideal patient consultation. I bet you give great consultations when you're working with your patients. How do you dial into what the aesthetic goals of your patients are when you're giving the consultation?
As soon as the door opens and I see the patient, I start assessing, even when they're talking. And I really like to see that because when the patient is talking, I'm looking at their natural facial
Mm,
movements. I say this to my patients all the time. If it doesn't bother you, it's not bothering me. I will never have my patient come in for a consult and leave feeling horrible about themselves.
mhm,
So, my key is to really listening to my patients, what they want to see in the mirror as an end result, but keeping their expectations completely realistic. Also, not changing their appearance, but enhancing their beauty. I convey that to my patients that if you're coming in to look like your face is gonna, be completely frozen and you're gonna look like wax, a mannequin, I'm not your girl.
mhm,
And this is a huge reason why I absolutely love your products because you really can give patients the most beautiful, natural, youthful outcomes without just filling their faces with a bunch of filler. For me, with my patients, they know that they're gonna look natural and I convey that to them. I can't say it enough. So having a detailed consultation and really listening to your patients and what they want to target. And then from there, getting them on a beauty plan.
mhm,
So I tell them, I'm not a magician. It's not going to be a one and done. And I use this theory all the time. Women that get their hair done and men that get their hair done, you want your hair to look good, right? So you got to maintain it. So in the
mm,
world of aesthetics, you're not going to see me every 2 weeks, but I'd like you to see me at least 4 times a year.
mhm.
So we put a
Very
plan in
smart.
place.
Very smart. What do you do for your practice as a whole from a marketing standpoint? If you're working with your patients to get their plan in place, what do you have in place for your practice?
I do a ton of social media marketing. I do a lot of paper, magazines, print. Most of my it's referral based. I get a ton of referrals. national. I've been featured in a bunch of local tri-state area magazines. I've been interviewed for MSN. And then also I have an upcoming article feature that will be in USA Today.
Oh, that's really exciting.
Yeah. So it's been a long time though. It's like I said, I've been doing this for so long. And I would say probably in the last 6, 7 years is really when things have just exploded. So it takes
Mm-hmm.
time, hard work.
A lot of hard work. Question of the hour. Where do you see yourself in your practice in 5 years with new technologies, anything, new products? What's the direction you're seeing?
Think I'm gonna keep bringing those new patients in, keep the retention of my client base and patient base now, but continue to grow. I do have a small staff that works with me that I couldn't do it without them because you can't be a one man show. I wish I could. I wish I could duplicate myself, but that's not going to happen. So continue to grow, continue to explore new technologies, new products out there. And if it's brought to me, I try it. And if it works, I love it and I bring it in and just continue to stay on the path I'm doing and keep going
Yeah.
where I'm going.
This is one of my favorite questions to ask people. What is something people should start doing and something people should stop doing within the aesthetic industry, whether injector or patient, you choose?
Okay. So stop overfilling your patients with fillers because it's not a good look. It's just not. There's a very specific look you get when you overfill faces. This has been the baseline of me as a provider, the collagen biostims, threads. I love my tox and I love my fillers. They have their places, but they're not targeting collagen stimulation and treating on the cellular level. Like I said, I want people to be beautiful, natural, have movement in their faces, and really look at the patient as a whole and just enhance and don't
Mm-hmm.
overdo. And good
I like that.
skincare. Good skincare is key. It's apples to oranges with over the counter to your clinical medical grade skincare.
You mentioned your team and that they are pivotal in your success. What is something that's motivating your team right now? How do you keep your team motivated?
I'm excited with they get their treatments and they see the results, right? So that's a perk in our industry, right?
Mm-hmm.
That's really nice. Educating, being supportive, hearing them. I try to accommodate their needs and listen to them. I come from a very big healthcare system. So sometimes when you're working in that medical field and you're not being heard from a
Mm-hmm.
clinical standpoint, it gets very frustrating. So I try to listen, understand, and have that human side, of listening to my girls. But also, I want them to be prepared and educated and knowledgeable. I teach them as I go. So when I'm doing the full thread facelifts, as I'm doing them, my medical assistants, I'm explaining to them and showing them this is why I'm doing this. If you look at the person and explain the golden ratio, right? As we're younger, as we age, and teaching them. So when they're talking to patients, they can actually explain things to them as well. It's really motivating and keeping them excited for aesthetics and new things to come and understanding.
We get a lot of experienced injectors like yourself that listen to the podcast, but we also get a lot of new injectors as well.
Mhm.
And we oftentimes get a lot of feedback on this particular question. So I'll ask you as well. If you were sitting next to an industry expert, what would you ask them today?
That's a hard question because there's so many of them. So, really, like, how did you get to where you are? How do you learn what you learn? Was it trial and error? What works best for you in a business standpoint to succeed, to be a leading provider in this industry? What are some of your little tips and tricks to stay above the rest?
I like that. If we all had the $1 million answer to that.
Yeah, right?
Yep. You mentioned this in the very beginning with the power of education and knowledge and hard work. But just to close things out, what would you tell a new injector or someone looking to get started in the aesthetics career today? What advice would you give them outside of the hard work?
Try to get under someone's wing that is a very seasoned injector, shadow, ask questions, and don't be too quick to pick up a needle. Really just understand facial
Mm,
anatomy. That's so important. Different products, what they're going to do, why they're going to do it, and
mm,
understand.
mhm.
So,
Love it.
really asking questions.
Nicole, this was very informational today, very enjoyable.
Thank you.
Where can people find you?
So I'm located in Cherry Hill in New Jersey. I have all social media platforms. It's ns dot aesthetics, aesthetics. It's spelled that way. And then our website. I'm always on the social media platforms, always posting and everything. And if people have questions and they want to ask, please feel free. I love to interact with other injectors and also patients or potential patients or current patients that have questions so I can be as helpful as I can.
Wonderful. Thank you very much. We appreciate your time and everything you contributed to us in the aesthetics industry.
Thank you. I'm so happy I could do this with you today. I was very excited to do it.
Absolutely. Have a good day.
Thanks. You too.